What are you doing? Good morning. As we speak, the members are gathering on the floor to prepare for a day when we're going to pass the HIRE Act to create jobs for the American people. Another step in our starting last year with the recovery package, going forward, and this is the latest step in that. It would provide support for small businesses to use tax credits and accelerated depreciation. It would invest in building infrastructure for the future for our country. It does so by triggering tens of billions of dollars of new investments in infrastructure. More on that if you have a question as to how it does that later. At the same time, this comes when the president yesterday called for an up or down vote, and we are preparing to follow his lead on that. We, again, as I've said to you before, waiting for this, freeze the design on the substance, get a bill, which I hope will be very soon, see what the Senate is willing to do, and then take up the issue with our colleagues. It is in the House. It is pretty exciting because we feel that we are on the brink of making very important history relevant to the lives of the American people. Affordability of health care for them, access to health care, hold the insurance companies accountable, and to do so in a way that reduces cost to the federal government, reduces the deficit, saves money for the taxpayer. You probably know now that we have a new acting chair of the Ways and Means Committee, Mr. Sandy Levin of Michigan. The chair was, as you know, the chairman asked for a leave of absence. The next person became acting. Mr. Stark became acting chairman, and then he laid a letter before the Congress today to me saying that that because he wants to retain his chairmanship of the Health Subcommittee, he wanted to not serve as acting chair. The Health Committee is a very important committee. It's been something Mr. Stark has devoted his life to as we move forward, not only to pass the legislation, but to implement it. He did not want to leave the chairmanship of that committee. So with that, today, as I say, we're pretty happy about bringing this jobs bill to the floor. It will be one in a series of other jobs bills that will come forward. That I'd be pleased to take any questions you may have. Yes, ma'am.
You're taking a lot of steps toward your goal of making this the most ethical House in history.
Yes, ma'am.
There remain some serious questions about some members, and I wonder what you would say to Americans who might wonder, are Democrats really any better than Republicans when it comes to ethics?
Well, you know, we spend our time meeting our ethical responsibilities to the American people by doing the job here for them, to making sure that the leadership that we provide and the legislation that we pass is in the people's interest and not in the special interest. And that is a high ethical responsibility for us. In terms of how ethics is, how we live up to that standard here, since I became Speaker, as you know, I established something unprecedented, an outside group to receive complaints and, if they saw fit, to convey them to the Ethics Committee. We have a functioning Ethics Committee, which is independent, bipartisan, and now functioning. My commitment to the American people is that the public trust will always be honored. And on the floor of the House, that happens. In terms of members' individual behavior, if there's a reason for them to have their behavior reviewed or the conduct of their activities reviewed, the appropriate process is to go to the Ethics Committee. I think we've come a long way since I became Speaker with the outside ethics group, and now to have a functioning Ethics Committee, bipartisan and independent of the Speaker.
Mr. Massa.
Sorry.
When did you hear about the allegations against Mr. Massa, and how concerned are you about them and about the reputation of the House Democrats in wake of all of this?
Mr. Massa called me yesterday and told me that he had been diagnosed with cancer and that he may not be seeking re-election. That was the first I heard of that. I asked my staff, I said, have there been any rumors about any of this before? There had been a rumor but not just that. No a formal notification to our office that anything had happened. It was a 1, 2, 3 person removed rumor that had been reported to Mr. Hoyer's office that they reported to my staff, which they did not report to me because, you know what? This is Rumor City. Every single day there are rumors. I have a job to do and not to be a receiver of rumors.
Can you talk about what you're saying to convince those of your members who voted yes on the health care bill the first time around and now are either on the fence or saying that they're going to vote no? What are you saying to them to bring them back into the fold?
Well, again, when I talk to my members, I have to have 2 important pieces of information. One is, what is the final status of the bill? And 2, what is the Senate going to do about it? What are the actions the Senate is going to take? The Senate cannot tell us that until they see the final product as well. I feel very confident that the up or down vote on the majority rule proposal that will come to the House will satisfy members' concerns about the Senate bill. That the Senate bill is that in terms of 4 areas: affordability for the middle class, which was very important to the House. We wanted stronger language and more resources for affordability for the middle class. We wanted to repeal the Nelson, Nebraska provision and have equity for the states. Third, we wanted to close the donut hole, and we did. And fourth, we wanted to change the pay-for. There was serious objection in our caucus to the taxation on the so-called Cadillac plans. 80% of that has been eliminated. So those are some of the key elements that are most well known. There's some other, how part-time workers are dealt with, other issues that were resolved in the favor of the House as well. And so what we're showing them is that in the legislative process, the process has moved much, the substance has moved much closer to the House. But our members are very excited about what is coming next. They want to see, before people commit, as you would too, they want to see what actually is the product. But they know, without even seeing the language, they know what the provisions, some of these provisions are. Now, of course, they want to see the actual legislative language as to how this would be implemented. When we go to that step, I feel very confident about how we go forward. So but we take it a new vote every time. This is every every legislative vote is a heavy lift around here. You assume nothing in terms of where you were before and where people may be now. You start 1, 2, 3, 4, all the way up to a majority vote, and respecting the questions that they have. We believe that the product will be good. The bill is smaller. So for some of our members who voted no, it has an appeal. The bill is smaller, because by its nature, the 51 vote, this being a budget bill. Let me make this point too. What the budget vote is about corrections to the Senate bill. This is not about doing health care reform under reconciliation. This is about doing corrections to the Senate bill under reconciliation. The bulk of the bill, 75 to 80% of it, is already in the Senate bill. So this is about a small percentage of what is there. And members they're pretty astute. They know these issues very well. And as soon as we get the language, we will do what we always do: sit down and read it to the caucus, have their Q&A on that, and then we'll see what questions they have.
One issue you didn't mention is abortion, and that apparently is not going to be a part of this corrections package. So you've heard Bart Stupak, and I think I'm sure you've talked to about a dozen or so anti-abortion Democrats who say, forget it, you're not going to have our vote anymore if this doesn't change. How are you going to deal with that?
As a matter of fact, they haven't said that to me. But let me say this. This is not about abortion. This is a bill about providing quality, affordable health care for all Americans. It's about bringing many more women into the health care loop in terms of their access to health care. I will not have it turn into a debate on, let me say clearly, we all agree on the 3 following points. If you agree on these 3 points, then we will have a health care bill. and we will. One is there is no federally funded abortion. That is the law of the land. It is not changed in this bill. There is no change in the access to abortion. No more or no less. It is abortion neutral in terms of access or diminution of access. And third, we want to pass a health care bill to provide much more health care for all Americans, and especially women who are discriminated in terms of health insurance and pay more. So if you believe that there should be no federal funding of abortion, and if you believe there should be no change in the policy, and if you believe that we need health care for all Americans, we will pass the bill, and we will pass the bill.
There are a number of Democrats who simply don't agree with that. Can you pass this
Well,
without